For decades, the global standard for treating mental health has relied on a specific historical framework. It's a model built largely on the individualistic Western traditions of psychoanalysis. But the clinical definitions of what constitutes normal behavior, abnormal psychology, and successful healing are not universal scientific constants. These concepts are defined by the culture surrounding the patient. This creates immediate friction when practitioners attempt to copy and paste Western therapeutic models into a country like India. In a deeply collectivistic society, a person's identity is tightly bound to their extended family, community obligations, and an intricate social hierarchy. Standard Western therapy is often non-directive, meaning the counselor expects the patient to uncover their own internal answers. Indian tradition, however, teaches individuals to seek direct, authoritative guidance from elders and spiritual figures, an approach summarized by the cultural hierarchy of mother, father, teacher, and God. When mental health treatments ignore these deeply rooted expectations, they often fail to resonate. Patients who expect active guidance find Western non-directive methods confusing, leading to ineffective sessions and a breakdown in the counselor-client relationship. Providing effective care in this environment requires blending modern clinical psychology with the patient's existing indigenous wisdom. Modern medicine often isolates psychological symptoms, treating mental illness as a localized problem existing solely within the brain. India's traditional medical system, Ayurveda, approaches the patient differently. It treats the individual as a fully integrated physical, psychological, and spiritual entity. Within this system is Sattva Vijaya Chikitsa. This Ayurvedic psychotherapy translates to conquest of the mind, using non-pharmacological methods to modify maladaptive thoughts. Mental illness is diagnosed as a disruption in the body's humors, doshas, and a severe imbalance in personality attributes like arrogance and indolence. This holistic view is mapped out in the Pancha Kosha model. It visualizes human existence as 5 interconnected layers, starting with the physical body and moving outward through the breath, the mind, the intellect, and the spirit. A clinician utilizing this model doesn't just target a surface-level emotional symptom. They trace the anxiety or depression through these interconnected layers to address both physical and cultural root causes. Long before Western psychology formalized cognitive behavioral therapy, ancient Indian cultural texts were providing the logic for sophisticated psychological interventions. Researchers point to the Bhagavad Gita as a blueprint for therapy. It centers on the warrior Arjuna experiencing paralyzing anxiety. Lord Krishna steps in as counselor, guiding him through positive reappraisal, a modern CBT technique, teaching him to reframe his environment and control his thoughts. To manage these internal conflicts, the traditional counseling process heavily utilizes the cultural concept of karma. Outside observers sometimes misinterpret karma as passive fatalism, but in a therapeutic setting, it operates as a framework for personal responsibility. It teaches that individuals have the power to change their destiny through their current actions. By drawing on texts the patient already respects, counselors translate abstract cultural philosophies into a mechanism for behavioral change that feels natural to the patient. Modern clinics are increasingly integrating these Eastern practices with Western clinical models, particularly through the implementation of mindfulness. Mindfulness builds metacognitive awareness. It asks the patient to observe their present moment without judgment. This breaks the cycle of negative thoughts and directly improves emotional regulation. This same practice cultivates the patience and empathy required for a counselor to build trust with clients from highly diverse backgrounds. This chart shows the results of an 8-week mindfulness program conducted in Indian mental health clinics. By tracking patients before and after the intervention, researchers recorded a 39% reduction in clinical anxiety. The exact same program resulted in a 41% reduction in clinical depression scores. Effective mental health care does not require a standardized export from the West. True healing is achieved when modern clinical methods respect and build upon the patient's ancient cultural identity.